Hello, doctors. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Cervical flexion is one part of Janda's movement patterns. Cervical flexion is performed with the patient laying supine on the treatment table, or it can be performed on the floor or on a bench. The patient's back of their head is contacting the table, the hips are flexed and the knees are flexed and the feet are flat on the table. What we want to do is ask the patient to actively perform cervical flexion. We are going to watch and see how they move. We want to make sure that the chin is moving towards the chest and that they are not protracting the cervical spine, meaning they are not lifting the cervical spine in this type of motion. The cervical spine is just moving into flexion. So I'm going to go ahead and ask the patient to do it. Okay, sir, go ahead and perform cervical flexion. Okay, and return to the starting position. Now, usually we would ask the person to do this 3 times so we can see exactly how they are moving. His motion was very good. Flexion was performed without protraction. Now what we're going to do is I'm going to ask him to actually perform the test incorrectly so that we can see what protraction looks like when the patient is trying to perform cervical flexion. So go ahead and perform it incorrectly. And then back to the starting position. So that would be a finding where the sternocleidomastoids are dominating the motion. Protraction is being performed instead of cervical flexion or before cervical flexion. If this happens, that would indicate a strength imbalance which is associated with upper cross syndrome.